And be sure it's on not on gallery, but on speaker. Okay. I'd like to welcome everybody today to the Jewish Voice for Peace Health Advisory Council webinar. My name is Alice Rothchild, and I'm on that committee. And today we have tech support from Maxine Fuchsen, who's also on the committee. So this is our 20th webinar in our webinar series, and it's titled The Many Assaults on Health in Gaza, a conversation with 3 Gazan clinicians. And the format of today's webinar is that there will be 30 to 40 minutes of conversation. I'm going to be asking questions, and we'll just go wherever the conversation goes. And then we'll have a Q&A from the audience. And we ask everybody to stay muted and to put your questions in the chat. And if anyone has escaped figuring out how to use the chat, I would just advise you to hover your mouse at the bottom of your screen. The chat box should come up, and you click on it and be sure it says to everyone, and you type your question. And obviously, if you write a 30-page question, I'm not going to take it because I'm screening all the questions. So keep them to the point, and then I will put them together as interesting questions. The webinar is being recorded, so if you don't want your face shown, you should keep yourself the video off. So I'm going to start by introducing the speakers, and the first thing I want to do is just thank these 3 clinicians for being willing to come talk with us just a week after a ceasefire, which is a pretty extraordinary amount of strength that each of them is showing. And I just think we should just remember that a week ago, Israel had bombarded Gaza and killed 33 people, including 6 children. Over 2,000 houses were damaged during the airstrikes. 31 buildings were completely destroyed. 93 families were made homeless, and 128 homes became inhabitable. And that's just the sort of death and physical trauma. And you can just imagine what it must have been like to be there. So I'm going to start now with the introductions. Haytham Abusenjar is from Gaza, Palestine, and holds a bachelor's degree in nursing from the Palestine College of Nursing. He has worked as a nurse in the oncology department at the European Gaza Hospital for more than 6 years. And then now he is working at the Turkish hospital, which is a cancer center. He's active in a number of several local and international cancer-related organizations. He was selected by the International Association for Hospice and Palliative Care as the first palliative care advocate in the Gaza Strip. And he gives speeches at many local and international events, including the Global Health Network Conference in Cape Town, South Africa. He's interested in cancer research, has published 2 studies so far, and is a fellow at the Center for Research and Education in the Ecology of War at the American University of Beirut. Basman Elderawi is a physiotherapist and a graduate of Al-Aqsa University in Gaza. He has been inspired by an interest in music, movies, and people with special needs. He has contributed dozens of stories and poems to the online platform We Are Not Numbers and other platforms. I should just say I'm a mentor liaison for We Are Not Numbers. It's a fabulous site. You should all go look at it. He is a co-author of In Light in Gaza, Writings Born of Fire, and Gaza, Land of Poetry. Hanan Abukmail is a physician who earned her MD degree from the Islamic University of Gaza, Palestine, and she's currently doing a master's degree at the University of Cambridge in the UK. Dr. Abukmail is strongly interested in healthcare quality improvement and health system strengthening. She's a co-author of papers published in high-impact journals, as well as in regional and national conferences. She's worked with different medical organizations to improve the quality and delivery of healthcare. So I want to welcome you all from all the different spaces in which you are living and where our participants are living. So I'm going to start out with a sort of big question, and that may be the only question we ask. We'll see where it goes. So the question is, describe your work as it relates to Gaza and healthcare under siege, including the recent assault. And why don't we start with, what the realities, the achievements, and the barriers. Who would like to start? Hanan, do you want to start?
Okay, first of all, thank you so much for hosting us, and thank you for all participants. as you mentioned earlier, I am a physician, a doctor in Gaza Strip, and I worked almost for 2 years, mainly in primary healthcare facilities and emergency department. Then I really enjoy treating patients one by one, but I think I moved to make an impact on and improve population health in general. So I am doing my master degree to have a solid and systematic knowledge about health system for all, universal health coverage, and how to improve health system to be more resilient to provide quality care for people. So if we can talk about healthcare system in Gaza, relying on the WHO blogs, I can mention some facts about healthcare system in Gaza in main 6 headings. First one is health workforce or healthcare worker in general. In Gaza, like medical staff have a very limited opportunity to enhance their skill and are often like cut off from learning about advances in techniques and best practices. For example, like cases of head trauma and spinal cord injury, which is require surgical intervention, are common in any busy health system. In Gaza, like the need for these quality neurosurgery services is increased by repeated Israeli attack and aggression on Gaza. But the reality in Gaza, there is like a very shortage. There's a shortage for specific specialties, especially the neurosurgery and oncology and heart surgery. And there's substantial barriers to travel for professional development and international conferences. And also health staff are vulnerable to military attack and being in danger in any Israeli aggression. This was the first heading. If we can talk about health access, which is the second heading, we can, according to the WHO statistics, 70% of Gaza referral to the West Bank on Israel require Israeli issued permit to access care, and nearly 1 out of 5 Gaza patients who apply for a permit receive a denial or experience a significant delay. If we want to talk about healthcare infrastructure, hospitals and facilities, we can say like health facilities also vulnerable to attacks on healthcare, and many hospitals and the clinics are still in disrepair. Electricity in Gaza can be intermittent and unpredictable. The lack of reliable electricity makes it even difficult to care for patients. Even if where like medical equipment exists, doctor cannot always operate it. And the current infrastructure of healthcare system doesn't incorporate rooms for the adoption of a new technology, which is meaning like missing lots of opportunities for quality services that are often provided through integration of technology to healthcare system. If I want to talk about essential medicines and supply, we can say in Gaza there is a long-standing shortage of essential medicine and medical disposal. For example, in 2018, the UNICEF has a report in which like they mention like nearly 50% of essential medicine at less than a month supply. And oncology services are among those most affected. Almost like there's a shortage of 85% of cancer drug across Gaza, which is meaning that chemotherapy treatment delayed or interrupted. And also Israel prevent access of many dual-use list medical supplies such as X-ray scanners, medical materials such as radioisotope, which is like used to identify and treat cancer. And also like Gaza Strip, for example, don't have any nuclear scanning technology, which is mean like patient most of the time need to be referred for West Bank or Egypt to be diagnosed with cancer and to determine the management plan for their disease. If you want in general, like WHO considered like Palestine in general and Gaza have a high cost of medicine relative to the international benchmark prices. And there's a delay in delivery, and there's incomplete deliveries and overall inadequate equipment because as we know, like Gaza is under blockade and air crossing is almost closed. If we want to talk about determinants of health, people in Gaza are at district risk for conflict, food insecurity, poverty, forced displacement, and severe restriction on access to healthcare, which is all in all these factors can affect the right to health. Also, like death and injury and exposure to violence have a longer term implication for physical and mental health. I can like conclude by the six main heading, which is like about governance and finance. Healthcare system in Gaza is really fragmented. It's donor dependent. It's mainly dependent on the international actors such as WHO, UNDP, and USAID, which is often support developmental project. And most times this sector is left to tend to be a project-based proposal, which means like there's foregoing existing deficiency and priority, and also the de-development of healthcare through economic damage and combating Gaza's political and functional separation from the West Bank. This is like the main idea about healthcare system in Gaza in general. Maybe I can make a conclusion like by two sentences. In any healthcare system, like no patient should have to worry about being prevented from accessing essential and life-saving treatment, and no health worker should have to go to work with a fear or with the fear of being shot at and killed. And these two conditions is not exist in Gaza at all, which is make Gaza healthcare system is really in a very bad condition. I don't know if one of my colleagues want to answer or like make any additional comment. So the floor is yours, either Basman or Haytham.
Okay, hello everyone. I'm so glad to be with you today. I have been working as a physiotherapist in the Ministry of Health here for 10 years now, and primary health care center. I can't add much to what Hanan said, but the point is, one of the struggles that we as a health provider have in Gaza is that there is no safe place and no safe zone in Gaza. Like last week attack, it was hard for us, almost impossible to reach the places where we can do our job. And also, as a physiotherapist, I can see that beside the physical injuries and the amputees and spinal cord injuries, as Hanan said, there is also increase in chronic pain, which is related to somehow to the mental health problem and to the mental health issue as well. And also, the research area and the healthcare system is very fragile and weak here in Gaza. But there is also a link to between like it's maybe a theory now, but a link to to the weapon that they use and how that weapon could cause pollution to the soil and the water, and also to what people face as a disease and injuries. So this is our concern as a patient, as a health provider here in Gaza, work with the patient.
Haytham? You want to unmute yourself, Haytham?
Hello, hello everyone. Thanks, dear Alice, for giving me this chance to talk about the current health situation in Gaza. Actually, in my speaking, I am going to talk about the impact of the ongoing Israeli blockade and the repeated armed conflict on the health situation in Gaza. I'm going to focus on the such policy, Israeli policies on the health situation, especially on Gaza cancer patient, because I have been working as a cancer nurse over the past 7 years. I think cancer patients here in Gaza are facing a myriad of obstacles in order to access to the healthcare and life-saving medical care. For example, in April 2023, the local Ministry of Health reported that around 255 drug items, which make around 43% of essential medicine lists, were at zero stock, including 27 of 63 essential drugs for cancer and blood diseases. Moreover, the Israeli authorities has been preventing advanced diagnostic measures from entering Gaza since the beginning of 2022. You can imagine, as this experience that I experienced over the past years, you can imagine that the patient, the oncology requested from him to do a PET scan. This PET scan is not available here in Gaza, so the patient has to apply for Israeli permit, which may take months. Then, if he desperately get this permit, so he or she travel outside Gaza to the West Bank or the Eastern Jerusalem hospital to do this image, which may take around 15 to 20 minutes. Then he returned to Gaza in the same day. You can imagine that hours of traveling inside Palestine territories and return in the same day, which would take also another hours. So you can imagine how the patient feel, like the mental and the physical effort I talk about the cancer patient. Another patient can go to the same hospital inside Palestine to get chemotherapy drug. Maybe it take 2 to 3 hours and return in the same day to Gaza. So it's what if we can make it available, the PET scans and such chemotherapy that's not available here in Gaza, to make it available for this patient, so can we save time and effort for thousands of cancer patients in Gaza. But I think, in my point of view, this is a partial tour from the Israeli authorities on the authorities who control Gaza here, and they want the people of Gaza to become dependent on the Israel. I think one important thing that I want to take that the Israeli permit system is an abortion tool that Israel is deliberately using it to restrict patients' freedom of movement, keeping the people in Gaza dependent on it. According to the Al-Mizan Center for Human Rights, around 63 cancer patients died while waiting for Israeli permits to be issued from the period between 2017 and 2022. And I am myself 3 years ago experienced a patient, 60 years old patient with advanced lung cancer, who died with night shift with me while in the hospital, while he was waiting a referral, a life-saving referral, actually, to get a treatment outside Gaza. Maybe this my comments on the topic. Thank you.
Well, thank you. I mean, it clearly seems that healthcare is completely imprisoned by the fact of the siege and the political realities that's sort of the message I'm getting from all of you. I'm wondering if you could give some more specifics related either to the impact of the pandemic or repeated assaults on things like immunization rates. You've talked about lack of supplies, the impacts on families. There were reports of increased gender-based violence during the pandemic, early marriage for girls because of the rising levels of poverty. Can you talk any more about those kind of issues? Hanan, do you want to start?
Yeah, I can start. Thank you. Before going through the COVID-19 issue, I want to share a personal experience related to cancer. During my medical training in pediatric department, there was like a 2 years girl diagnosed with a blood cancer, and she need chemotherapy, but none of her parents receiving an Israeli permission. And by the end, like this 2 year care, they didn't receive the medical treatment, and she died in Gaza just because her Israel don't give a permission for her parents to go to the West Bank and receive the permission. So I feel like it's too tragic that till this point we are 2023 and people dying from having no access to medical care. Regarding the COVID-19, when the COVID-19 started, we already know that the health system in Gaza is under-equipped and there's no enough medical supplies and essential. So we can conclude when the COVID-19 started, the health system in Gaza was not ready at all to deal with it. And because during COVID-19 outbreak in May 2021, there was an Israeli aggression to Gaza. And as a result of casualties, severe injury, and COVID-19 pandemic, hospitals are becoming overwhelmed. And just imagine you have an Israeli, the healthcare system need to deal with COVID-19 and at the same time need to dealing with another Israeli attack at the same time, which is resulting in additional decline in public access to basic services across the Gaza Strip, including the health facilities access routes. And during that attack, there was a damage for 6 hospitals and 11 primary health care centers, and 1 center suffering from severe damage, and 1 hospital was not functioning due to the lack of electricity. And also that period, the Central Laboratory Center for COVID-19 PCR testing was damaged from Israeli airstrike, and all COVID-19 PCR testing was stopped except for the people who are traveling to Egypt. Just imagine that any healthcare system during the COVID-19 outbreak need to deal only with COVID-19, and their healthcare system are in a better have at least equipment and essential medicine, but in Gaza no, the health system is under-equipped, and in the same time there's a shortage of medical supply, and there's many trauma to be dealt during the COVID-19. And I think this is the main idea I have about COVID-19 period in Gaza Strip. I don't know if Haytham and Basman want to add more.
You have to unmute. Either of you want to make more comments, or Basman?
Oh, okay. On the last attack on Gaza next week, one of the hospital in the middle of Gaza Strip, Shuhada Al-Aqsa Hospital, was really affected by hitting a house just next to the hospital, and the hospital was partially damaged, and also the patient were panicking, and also as Hanan said, They attacked us on May 2021, which was like the ultimate time of pandemic and COVID and so on. So it's like it's ongoing. It's like ongoing Nakba, ongoing trauma, and also I know that the people here in Gaza doesn't talk so much about mental health issue or about like their feeling, but also it's affected because the trauma, as I said, there is no PTSD on Gaza. The trauma is never end, is ongoing, and people doesn't have that time to heal and to rest, to even rest, which is really affect the whole community here in Gaza.
Haytham, do you have more to comment or?
Yeah, I want to talk about the impact of the pandemic, COVID pandemic on the healthcare system. I was a frontline worker for the pandemic 3 years ago, and one experience that I'm going to tell you about that was amid the pandemic in Gaza in 2020, and because of lack of beds in the hospitals, I was taking care of around 15 COVID-19 patients by myself. And the patient, I didn't forget this, the patient were in the corridor and between, there is no beds available to take care of the COVID-19 patient. The healthcare system was overwhelmed and is still overwhelmed by many reasons.
Mm-hmm. So I have a question. There's an expression in the US, a care for the caregiver, how to keep people from just totally burning out and being unable to function as a caregiver when you're at risk for the same assaults and trauma as your patients. Is there any talk of that in Gaza, or any things that institutions or groups do to keep you all functioning and not falling apart given the level of mutual trauma you have with your patients?
I think this is a really a tricky and difficult question. Maybe if we just like start about like mental health in general, like long conflict has posed a significant threat to both physical and mental health for all vulnerable and people in Gaza, vulnerable citizens in Gaza, including the doctor and healthcare staff, because at the end, like even the doctors and nurses and healthcare workers, they are a citizen in Gaza. So like people already experiencing stressor associated with insecurity, illness, loss of family and friend, loss of homes, livelihood, uncertain future due to financial instability, and then the COVID-19, and then like as Basman said, like crisis upon crisis, emergency upon emergency. So at some points, I feel like really the mental health of care provider is, I can see it's like severely damaged. If I can share something like my personal experience, I have been working in emergency department during May 2021 Israeli aggression, and at the end of the attack, literally I wasn't able like to talk with anyone, even my family, even like when I go to my work, I feel like I don't need to listen or talk, or I don't need to do anything. And like I wrote a story about that, which is like Dr. Torment in one We Are Not Number platform, if anyone interested to read. So I think, yeah, like healthcare workers, mental health is not in a good condition, but at the same time, like this is like the Gaza reality. Like people need to go to their work and continue their life, even if their mental health is really damaged. And I think there is no strong or systematic approach to improve the mental health of either Gazan people, including the healthcare workers. So I think Gaza Strip in general don't have very solid mental health services.
Do either of you have more to say on that, or is that?
Okay, like there is no, as far as I know, there is no a lot of a program. There is no programs to care about mental health for care provider or caregiver. Like personally, I always run to writing and to, but it's just my personal zone, and just I just give advice to some patient to do some techniques, some breathing, some kind of issue, but as a system, there is no program for that. And here is the question: how will this program help while the trauma is ongoing? While the trauma is never ended? Like, okay, we all need rehabilitation. We know that psychological rehabilitation and psychological support and mental, but how will that help when the trauma is ongoing? This is the question.
Right. Haytham, do you have any more to say on that?
No, thanks.
Okay, so I'm going to turn to.
Maybe I can like add it extra. I always remember, like during my work in emergency department, I always remember the shocked faces for people came to emergency from the ambulance, and at some point I feel like I am really scared for the survival found in the rappel, the mental damage from the trauma of being like literally paired before finally being rescued. Like people in general, like will having an accelerated heart rate, inhaled dust and toxin, skin shred by shrubs, and like even like the fear of being trapped and never being found. So I feel like even like some survivors who already arrived to the hospital are slowly bleed out and then die within minutes of resuscitation. So I feel like literally the mental damage is really deep for all people in Gaza, for all people living in Gaza, and especially for the healthcare workers who need to who need like to be strong and brave even during the Israeli attack, and need to treat people and able to see all these tragic scenarios. And at the end of the Israeli attack, these healthcare workers need to go out, wake up and go out and just like continue their lives and start like to treating people without like at least making a small reflection of the tragedy they have lived either during emergency department, or for example if any people work, any health worker working during the Israeli attack, he need to treat people, but at the same time he will have like tons of concern about his family or her family safety. Like you will be in the hospital and try to treat people, but at the same time you know that any person can be a target by Israeli attack, and maybe at any point you can see one of your family members in the hospital. So I feel like the mental damage, like no sentence or no word can explain the mental damage of people living in Gaza, including the healthcare workers.
Mm-hmm. Thank you. That is a very powerful way of trying to understand. That is really puts it home here. I'm going to turn to the questions that are coming in. Amy, who's also on the Health Care Advisory Council, asks, how do you folks obtain prosthetics for the folks that need help, orthopedic help, or that kind of damage?
It's almost supported by international group like ICRC, like the MSF group. They always like provide a prosthesis or something like that.
Mm-hmm.
Not from the system itself.
Not from, so you rely on NGOs to do that.
Yes.
Yeah, but I think we need to focus like all these programs is donor dependent. So if the international organization don't have the fund to do it, there will be no program. So as I mentioned before, like healthcare system is like a project-based. It's mainly a project-based proposal. There's fund. There's a mental health care services for some people. If there's no fund, that's meaning like no mental health care services for people.
Do you think that the conflict between Hamas and the PA affects the inability to create a real healthcare system that's not an NGO dependent healthcare system?
I think Israel as occupying power retained the primary responsibility to respect, protect, and fulfill the right of health in occupied Palestinian territory, either in West Bank or in Palestine. And like Israel as an occupying power needs to fulfill the right of health to Palestinian in line with international humanitarian law. This is like the only sentence can be said about the right of health. Right of health is not like something can be negotiable between Palestinian leaders and Israel. No, right of health should be protected regardless of the conflict between the leaders or between the countries.
Got it.
Yeah, I totally agree with Hanan. It might affect in some zones, but the responsible for that healthcare system in Gaza is fragile and weak is the occupation, because simply the occupation is responsible for the blockade, which affects the economy of Gaza and the financial aid in Gaza, and also it's responsible for the equipment, for the permission for the people to travel from in and outside Gaza, even for seeking treatment. So it's the responsible for the health care here is the occupation as well.
And could one of you elaborate more on the permit situation? What is involved to apply? How long do people wait? Are there international groups working specifically on the human rights issues of needing permits for essential care outside of the Strip?
Yeah, actually, when a patient is written a referral outside Gaza, and I think the vast majority of referrals for cancer patient, because the treatment, it's totally unavailable. For example, the radiotherapy is totally unavailable here in Gaza, and some chemotherapy, and maybe around 60% of chemotherapy is also unavailable. So the vast majority of patients who need to get a treatment are cancer patients. So the first one is the referral is sent to the Palestinian Health Committee, which consider this this referral if it's there is availability or possibility to treat this patient in Gaza. So the referral is refused, and if not, then the Palestinian Authority make it the referral to the Israel side to make the Palestinian to make the permits. Normally it takes if the referral is life-saving, it may take 2 or maybe 1 or 2 days. But if that's normal referral, maybe it take 1 week to 2 weeks to get the permits. And as I said before, there is a big, large numbers who have their permits refused for several reasons, and patients died while waiting for their permits to be considered by the Israeli permits. Yeah.
And then people, do they have asked for a permit for a companion, and the companion has to get a permit? And
yeah, I think there are NGOs who are working in this issue. The patient, I mean, the patient who get who had their permit refused by the Israel. For example, Al Mizan Center for Human Rights. There are, I think, Beit Salem. It's an Israeli NGOs, and there are. Yes, there are many another organizations.
Physicians for Human Rights Israel also works on permitting.
Yeah, of course, yeah.
And is it different if people are going through Egypt versus going to the West Bank?
Yeah, because the total health services for cancer patient to get treatment in the West Bank is totally purchased by the Ministry of Health. So the patient have to do nothing in accordance to the health service they get. If they can travel to Egypt, so can they pay from their own pocket?
I see. And just to give people an idea, you know, I know that when people get the permit and leave Gaza, they have to go through this 3/4 mile no man's land corridor that's like in a wheelchair or on a stretcher. And then
Yeah.
are they met by an ambulance on the other side or a taxi, or how do they get from Erez checkpoint to like Al-Maqasid in East Jerusalem? How does that happen?
If the patient need ambulance, the doctor who made the referral write in the referral that this patient need ambulance, so the ambulance is ready when the patient get to the Israeli side.
And is it a
Yes.
Red Crescent ambulance, or is it what kind of ambulance is it?
A normal ambulance, yeah.
Like who pays for it?
Oh, it's included. It's included in the referral, yeah.
And either of you want to make any more comments about that?
Yeah, I think I read before in one of the WHO document that the mean days for receiving a permission for patient, like for patient to have been referred to West Bank is 25 days to receive a permit.
Mhm.
And I think even if the patient receiving the permit to go to the West Bank, I think like the period from just like crossing the areas is not an easy going, because patient cannot take any food, any drink with them, and they need to go through several checkpoints and security procedure, even if the patient is really like sick. So I feel like even if the people who are treated in West Bank, they need to like, I think the suffering is not only it's not ended when the patient receive the permit. They also another story of suffering through going through airs and then going to the West Bank and then going back to Gaza, which is really unreliable for people who are really sick.
I mean, going through Erez is not just you walk across Erez. There are all sorts of checkpoints and security things and X-rays and searches.
Yeah. Like for example, you can stay for 2 or 3 hours, like just to go from Gaza Strip, just like to pass ages across it.
Right. And then you have to do the same thing going back.
Yeah, exactly.
Right. So one person says, I'm often inspired by the ways Palestinians in Gaza figure out workarounds to care for one another. Can the health professionals share some of their stories of when they used untraditional methods to care for patients and their care?
Like, I mean, I cannot say it's untraditional, but personally, I love, like, even when with my writing, I like black comedy a lot, and I like to make jokes around the situation that we live here. And I think sometimes I just share it with my patient. Like after the last attack on Gaza last week, we all share that the joke that we already like have a degree of surviving assaults. Like I have a master degree of surviving assaults now, and we all share that joke, like counting how attack we are witnessed, and then apply a degree for that. So it's like sometimes just sharing jokes, sharing funny stories about that. But it's not untraditional. I think it's traditional as well.
Hanan or Haytham?
I don't have any comment.
Okay. Haytham?
I don't have as
Okay. So Maxine says, of course, the work we need to do is to end the Israeli policies of occupation, siege, and aggression. But are there immediate things that health workers from Gaza you folks would ask us from the international health community, what things would you want us to prioritize in terms of health?
I think one important thing that we should the international community should work on, that trying to localize the healthcare services, especially for cancer patients in Gaza, so the patient cannot rely on the Israeli to get their treatment outside Gaza. We should make it available, for example, interim diagnostic measures such as PT scans, X-ray, mobile X-ray, and so on, that the patient and the oncologist needs for the diagnosis procedures. Radiotherapy, it's unbelievable that here in Gaza, around 2 million people have no radiotherapy for cancer patient. It's unbelievable, yes. It's available in every place in the world, it's available, but here in Gaza, it's not. I think one thing that the international community should work in, just to trying to localize the healthcare services, especially for cancer patients. And I think it's easy, and it's just part of the human rights that we are calling upon.
Hanan, or?
Yeah, I think maybe like the increasing number of attacks on healthcare facilities and healthcare worker need to point to the immediate need for strengthening the protection of healthcare from any conflict-related violence. Because like as I mentioned, like no healthcare worker should like having the fear of being shot at or killed while doing her or his job. And as I mentioned, like because occupation leaves Palestinian to bandage emergency after an emergency and crisis upon a crisis, this make it like difficult for health sector to plan for long term. So I think in Gaza we need to work more on strengthening the health system to be more resilient in dealing with the trauma and with the casualties of people during attack, especially like the emergency preparedness services and emergency department services, because like these department and surgical department, because this is like the main front line for providing care during the attack. And as I mentioned earlier about some specialty, there is a limited specialty in neurosurgery and in heart surgery and in advanced technique in surgical intervention. Maybe like if an organization can facilitate medical staff training outside, just like to have extra technique and advances in medical intervention that can be used to treat people in Gaza.
People also talk about the issue of the NGOization of healthcare, that Gazans rely on NGOs, and then there's no creation of a viable healthcare system. So there's all that tension there.
Yes, totally agree. And this is I think from my personal perspective and like from my study here in the University of Cambridge, we need to make the Ministry of Health as a main care provider, and we need to strengthen the healthcare system among the governmental services so we can have a more resilient health system in Gaza. Because like once the health system is really dependent on NGOs, the health system will be fragmented and donor dependent, and there will be like no long-term improvement and development in healthcare system in general.
Paola, I know that you've had your hand up, even though we asked people to write the chat. Why don't we unmute you and you can ask your question? Maxine, could you unmute Paola? She's working on it. Paola is a Palestine Solidarity activist from Italy.
I'm saluting all the Gaza people. What you said goes deep in my heart. And I know the situation is increasingly worse. I was working in Gaza since 2010. So I know a lot about what's happening there and in time. And now I have to ask only a question, not make comments. And my question is, how is increasing the cancer rate in Gaza? If you work in the Turkish hospital and you worked before in the European hospital, do you have statistics of the change in time in the last 10 years in cancer cases? Because one of you, I think was you, Haytham, mentioned it. We think that the environment is polluted by war remains. I know it. I studied that while I was in Gaza. I know that there's an effect on newborns, and most likely it has to have an effect also in the incidence of cancer cases. But I did not study that. I don't have cases. But even observationally.
So your voice is a little quiet, so I'm just going to repeat the question, which is, have you seen a change in the rate of cancer and also the impact on newborns? And what we know is that the environment is polluted by chemicals from war, pesticides, all sorts of, Israel will test out their new weaponry on Gaza, so we never know exactly what's falling from the sky. Do you have any statistics or personal observations about that?
I don't have like a clear statistics and number, but like because I am working in cancer awareness a project in Palestine, which is like a research project. I know that the cases of cancer cases in Gaza Strip is going up during the last years, and one of the justification and explanation is like the Israeli attack and like tons of chemical on Gaza Strip. So I am sure that there is an increase in cancer cases, at least in the past 10 or 20 years. But I don't have like the clear statistics. If I will search about the statistics and I can share it with Alice, and Alice can can share it with you. I would be more than happy to look for these numbers. I don't know, like if Haytham or Basman have.
No, I don't
Yeah.
Okay, go on, Haytham.
Okay. Actually, I have a statistics because I am interested in cancer research here in Gaza. According to health authority statistics, show that the incidence of cancer in Gaza Strip has increased from 8 to 10 per 100,000 residents in 2016 to 91.3 in 2022. And in 2022, around 2,000 new cancer patients were diagnosed, and there were 60 cancer deaths in 2021. Breast cancer is the most common type of cancer among females, and colon cancer is the most common cancer among males. Nowadays, there are around 8,000 cancer patients in Gaza.
I have a question. I've always been sort of stunned by how there is very little screening. So is there any mammography functioning in Gaza now for early detection of breast cancer? Is there any?
Yeah, it's available mammography in Gaza, but in limited places, not everywhere.
Okay. So most women do not get screened with mammography. I mean, I was told that you get a mammogram when you feel a lump, and I was like, well, that's a little late, Is that how it works?
Yeah. Maybe here I can like mention like most of cancer cases, especially the breast and colorectal cancer, discovered at a later stage and advanced stage, in which like the mortality rate is higher and the morbidity rate is also higher, because like screening is not it's not available everywhere in Gaza, and because like people have have many complaining from poverty and like financial instability, people like generally will not pay to do the screening and looking for their health. Maybe they can prioritize and like paying for food, paying for their children medication. So if people need to do the screening, they will go through the Ministry of Health. And if I can share something, like during my work in during my internship in Shifa Hospital, which is like the main and the central hospital in Gaza Strip, the colonoscopy, which is used to screening colorectal cancer, was not working for almost 1.5 months, and all people who need to do a screening for colorectal cancer or as a part of their management to be diagnosed with colorectal cancer need to pay and do it in a private sector. And then, as we know, most of people in Gaza is under the poverty line, and they will not pay to do it. So
Yeah.
people will be diagnosed in an advanced stage, and the mortality rate will be like higher, as I mentioned.
And my understanding is that most women don't get lumpectomies and radiation treatment because there's no radiation treatment. So women tend to get mastectomies, which are much major surgeries and much more deforming and
and if we want like to talk more about that, like in Gaza, we don't, in Ministry of Health, they didn't provide a plastic surgery for a woman having a mastectomy, except like for some some exceptions. So if we have a scenario like a lady or a woman from Gaza who has diagnosed with breast cancer, and because the health system cannot provide radiotherapy, or because she is not having Israeli permission to go and receive chemotherapy, radiotherapy, that's meaning she will do a mastectomy, which is like a second line management, not a first line management. But because like this woman had been diagnosed with cancer in Gaza Strip, she need like to accept mastectomy. And even if she did the mastectomy, she will have like her mental health will not be in a good case, because like either being diagnosed with the breast cancer and either having the surgical management of breast cancer. And this, but by this scenario, this is like the usual case for any woman having breast cancer elsewhere in the world. But in Gaza, no, we need to aid extra. Like this woman, she can lose one of her family member during one of Israeli attack. Maybe her husband will not have a job for like 2 or 3 months. They were struggling finding food. They were struggling paying education fees for their children. So just like imagine the burden of, because like we talked about mental health, like just imagine the mental health of this woman. Like she need to express the mental health of being lived in Gaza and having and being under Israeli aggression. She need to handle that she is a breast cancer survivor. She need to handle like that she did a mastectomy, and she need to handle the poverty and financial instability in Gaza, which is really a lot.
Plus, there's the cultural stigma of having cancer.
Thank you, Alice. The cultural stigma, In Gaza, we have cultural stigma for mental illness and for physical illness.
Well, do either one of you want to have the last word on this? Because I'm about to wrap this up. Basman or Haytham?
Well, the point is, as I think Hanan said it all. The point is, as we said, the attack on Gaza and the war affect like every aspect of the Palestinian life. Like, as you said, the pollution could affect the cancer patient and increase the rate of cancer, and also could affect mental health as well. Could affect like we have like increase in other diseases like gut issue. We have increase in like even suicidal rate increased, and it's overlapping because the attack on Gaza, also the economic health situation and the blockade being imposed on Gaza as well, have also the effect over the health system and the health care here in Gaza. So it's complicated, but at the same time, we all know who's responsible for that.
Right. Haytham, do you want to say anything, or it's been said?
No.
Okay. So-
Maybe I can add something, because
Okay.
as we mentioned about, I think Ola who mentioned about the chemicals and air pollution and cancer risk and cancer incidence, in an indirect way, like these chemicals will affect the agriculture in general in Gaza, and will affect the water. So people will either eat or drink unhealthy water and food, which is like can increase their risk to having cancer. So all in all, like as Basman said, like every single aspect of life in Gaza is affected by Israeli attack, and we can find a way how the right health is affected in many different like aspects, either in food, in water, and healthcare services, and mental health.
Yeah, and even and Hanin, even the pollution has effect on the mental health, not only the attack, not only the effect of the assaults or something like that. Even the food has an effect on the mental health as well. So it's very like complicated. But as I said, we all know the responsible for that.
Right.
One solution.
So I just want to thank you all for this very moving and important conversation. It's behooves us in the international world here to be doing the political work and putting pressure on organizations and governments to end the Israeli occupation and siege. And I would urge everyone to join the Jewish Voice for Peace Health Advisory Council. Our website is jvphealth.com. And we put out a lot of alerts. Then you can take it to your own community and to your health communities, and also use it as information to be pressuring governmental agencies, Congress, all the people and programs that we know are actually in charge. Because as one of our people on this webinar has said, our dreams and plans are under attack. So it's not only health, mental health, physical health, public health, it's also the future of Gazans and their dreams and plans. I do want to just remind people that the Health Advisory Council puts out a monthly media watch in which we take a look at health and human rights issues that have come up over the last month or two. And we do other advocacy and writing, and we're always looking for folks who want to get more involved, because our limitations are that we're a small volunteer organization and we need more people. And we do want to support the people in Gaza who live under a lot of oppressive conditions and have enormous resiliency and strength. But we do know, as Basman keeps saying, why this is happening. So I want to thank you all, and please sign up on our website to join the group. And thank you all from Gaza. This has been incredibly important. Take care.
Thank you so much for the active listening and for hosting.
Yeah, thank you so much for having us.
It is honor. It's our honor, let me tell you. Thank you so much.
Thank you. Thank you.